Hi, hello and welcome. Welcome to the channel. Today we will be discussing about cryptorchidism. So, first of all, you must know what is cryptorchidism is. A cryptorchidism is otherwise known as undescended testis. It is not a very serious condition. When the baby is born, as a pediatric nurses, we will be doing all the general assessment of the baby. When we are assessing the genital organs, we come to know that there is a empty pouch, that is empty scrotal pouch. It means that the testis had not descended into the scrotal pouch. That is known as cryptorchidism. A testicle that doesn't move down into its proper place in the scrotum before birth is called an undescended testicle. It is also known as cryptorchidism. An undescended testis is more common in premature babies than in full-term infants. An undescended testis often moves down its own within a few months after the baby is born. So crypto means hidden and orchid means testicle. It is the most common birth defect of the male genitalia. About 3% of full term and 30% of premature infants boys are born with at least one undescended testis. So we'll see what is the definition is. The cryptorchidism is a failure of one or both the testes to reach the normal position in the scrotal sac through the inguinal canal. Cryptorchidism is the absence of one or both the testes from the scrotum. So from the definition it is very clear that the cryptorchidism or the undescended testis is either unilateral or bilateral. That is, unilateral means either one of the testes will not be descended. Bilateral means both the testes will not be descended into the scrotal pouch. This is known as cryptorchidism. Next we will see what are the causes of undescended testes. The exact cause of undescended testis is unknown, that is idiopathic. A combination of genetics, maternal health, environmental factors might disrupt the hormones, physical changes and nerve activity that influence the development of the testicles. And other causes like impairment of hypothalamic pituitary gonadal axis, anatomical obstruction, that is there may be an obstruction in the pathway of descent or failure of intra-abdominal pressure to rise, hereditary or any chromosomal anomalies, that is absence of one or both the testes, or short spermatic cord, and artery mechanically prevent the testis, and ectopic attachment of the testis. So these are some of the causes of undescended or cryptorchidism. So what are the risk factors is low birth weight, premature birth, family history of undescended testicle or other problems of genital development, condition of fetus that can restrict the growth such as Down syndrome, alcohol use by the mother during her pregnancy, smoking during her pregnancy, obesity in mother, diabetes in the mother, that is type 1 or type 2 or gestational diabetes, parents exposure to some pesticides. So these are the risk factors to attain the cryptorchidism in the baby. So next is clinical features. A non-palpable testis that is unable to feel on examination is the most common symptom of cryptorchidism. However, each child may experience symptoms differently. Symptoms of cryptorchidism may resemble other conditions or medical problems. So diagnosis soon after the baby is born or during a routine checkup when they are 6 to 8 weeks old. Physical examination. The first stage in diagnosing undescended testis is to carry out the physical examination, that is palpation of the scrotum sac for the testis. If the scrotum sac is empty, it is diagnosed as a query as undescended testis or cryptorchidism. And further test we can do is ultrasound scan, CT scan, that is computer tomography, diagnostic laparoscopy, hormonal assay and urine and blood test. So these all, so the main diagnostic evaluation is physical examination, and further we can proceed to these examinations. So next we'll see what is the management. In most cases the testicle will descend without treatment during the child's first year. If that does not occur, treatment may include hormonal injections, that is beta HCG or testosterone, or try to bring the testicle into the scrotum. It also helps in the enlargement of the testis. So this is the one of the management of the cryptorchidism or the undescended testis. So next we'll see about the surgical management. The surgery like orchiopexy to bring the testicle into the scrotum. This is the main treatment. If there is an associated hernia, the herniatomy along with orchidopexy is indicated for the babies with cryptorchidism. So next we'll see the complications. If we are not doing the prompt treatment, it may end up with testicular cancer, fertility problems in the future terms, testicular torsion, trauma, and inguinal hernia. So these are the complications if we do not diagnose the disease very early and do the treatment process. Next we'll see the nursing management. So first we have to understand the surgical treatment and explain to the caregivers, promoting the normal urine output, monitor the daily intake and output, encourage the adequate fluids and monitor the daily weight, care for all the catheters and urinary tubes according to facility policies, maintain the appropriate position of tubes, observe and record amount and appearance of urinary drainage, occurrence of bladder spasm, symptoms of urinary or incisional infection. So these are some of the nursing management when the baby is being posted for the surgery. That is, pre-operative and post-operative nursing care should be carried out for the babies. If the condition does not require any surgical treatment, you can wait till the baby's testis get descended into the scrotal sac, and you have to educate the mother and the caregiver regarding what is the disease condition is, what are the medical management, what are the surgical management, and what is the prognosis of the disease should also be explained to the caregiver. And we have, as an addition to nursing management, you have to provide emotional support regarding the body image, continue the reassurance about appearance of genitalia, prevention of infection is the very prior nursing care, administer antibiotics and IV fluid as ordered, and assess the patient's skin turgor and mucous membrane for signs of dehydration, provide a comfort to the baby and the caregivers, administer analgesic as per order according to the assessment of complaints of pain, the restlessness, crying or withdrawal. Administer antispasmodics as ordered for bladder spasm and provide distraction and comfort measures for the baby. The babies have the pain, you have to administer the analgesic as per the physician's order. So these all are the medical, surgical and nursing management for cryptorchidism or undescended testis. If you have any doubt, kindly drop down in the comment box, and if you like this video, kindly like it, share it and subscribe it. This channel aids as a learning platform for all the nursing fraternities, nursing students, for improving their knowledge and the professional growth and continuous learning. So thank you for watching. Don't forget to click on the bell icon for latest updates.